So your midsection is a little loosey-goosey. Maybe you've tried everything and you just can't get that flat tummy that you desire, so you've thought about the double T, the tummy tuck. Joining us right now is Dr. Peter Chang. First of all, doctor, let's talk about what is a traditional tummy tuck?
A traditional tummy tuck is basically taking our skin from below the belly button all the way to the pubic region, right above the hairline, and taking all that skin and fat out in one piece.
But what you do is called the timeless tuck. How is that different from the traditional?
Right. At Timeless Plastic Surgery, we have a list of timeless procedures, and the timeless tuck is just one of those procedures. Now, I developed the timeless tuck through years and years of experience in doing tummy tucks. What I didn't like about the traditional tummy tuck is that it didn't address the areas of the hips, the waist, and the upper abdomen. Because if a patient has a lot of fatty tissue around the abdomen, the upper part is thicker than the bottom part. So what happens is that you need to add liposuction or some form of liposuction to the abdomen and to these other parts of the area, like the trunks and the back, to allow more of a contouring. So with the timeless tuck, it's a 360 truncal liposuction around the whole entire body, and then removing the excess skin on the bottom.
It sounds like you're almost doing like an internal girdle.
It is. Yeah, in tummy tuck, there's what we use is sutures and stitches to give an internal girdle to tighten up the muscles inside, so that it gives you kind of an internal six-pack that you have a flat tummy afterwards.
So with this timeless tuck, you're also doing some liposuction in there to get that 360?
Right, right. When done at the same time, liposuction and tummy tuck, it takes down the fatty tissue, and that allows the tummy tuck to be pulled even tighter than the regular tummy tuck.
No, I have to say, now with liposuction, I've heard that once you have it done, then the fat goes somewhere else in your body. Is that true?
Part yes and no. When you have liposuction, in the areas where you had liposuction, the number of cells are gone already. So it won't come back in that area as much. It'll go to other areas that have not had any type of surgery or scarring in there.
So this timeless tuck that you created, let's talk a little bit about your background, because I think it's very interesting that you were first in dentistry and then made your way over into plastic surgery, and you have years and years of education.
Yeah, that's true. I got into dental school from straight out of high school, into one of those 7-year accelerator program where I finished college in 3 years.
You're a smart cookie is what you're telling me.
Basically. Well, I've had more training than the average plastic surgeon. I've had about 8 years more of training. So in dentistry, what that has taught me is to have a stable hand. When you're holding that drill that's running at 300,000 RPM versus holding a scalpel, it's really easy to hold a scalpel because it doesn't move. So dentistry has taught me to how to be stable with my hands and how to be more precise. And that has helped me with my plastic surgery as I am more precise and detail-oriented in doing my surgeries.
I got to brag on you a little bit more because you are the only board-certified plastic surgeon in the United States with 2 Ivy League degrees, 2 doctorate degrees, and 2 surgical residencies. So you come with a lot of experience. So let's see some of your work. Let's start looking at some of your actual patients. Our first one, this is a side view, the oblique view. Let's talk through this.
Well, this is a young woman. She's tried everything. She's tried for exercising, dieting, and she hasn't lost her midsection. And she wanted to be a new self and a new body. So she came to me and asked what I can do. So I offered her the timeless tuck, where we did liposuction of the abdomen and the truncal area, and took out the skin in terms of a tummy tuck. So she got the timeless tuck.
I'm just amazed at this because it's kind of a little bit of that like jelly belly, but then she goes to this absolute flat tummy. How long is the difference in this?
Well, the difference in the before and after picture is about 2 months. Okay.
Wow. And traditional change in dress size for a woman, what might she see?
At least anywhere between 2 to 6 sizes.
Really?
And more, depending on the body habitus. The bigger you are, the more I can take down.
Let's move on to our patient number 2. This one, I have to ask, okay, so in the before picture, what's the background there?
Well, this woman had an emergency appendix surgery when she was a child, and she's waited about 5 decades to get this done. She's always hated her body, and as she gained weight, as you can see, the weight gained around the scar, and the scar kind of dented her body. So she came to me wanting to, reduce this tummy, and she didn't like how the scars were.
I bet she had some serious tears of joy after that flat tummy came along.
Oh, it is. She's an amazing woman. Well, the reason why she took so long to get this done is that she always put others first. They're doing charities and community work, and she didn't put herself first. So basically, after 5 decades, she's a little older than 5 decades, but it's her time. So it was her time and her turn to do her take care of herself.
To do something for herself.
That's
Okay,
right.
so let's talk about the guys. Do you see a lot of men that come in?
Yeah, nowadays, plastic surgery is not just for women nowadays, especially tummy tucks. More and more men are having plastic surgery procedures, especially tummy tucks as well. Now, this man right here, he's an older gentleman. He's active and he's healthy, and he lost about 100 pounds, and he had a lot of loose skin in the lower abdomen, as well as the upper abdomen and the rest of his trunk, and he wanted to get rid of it because he wants to pursue an active lifestyle, but the skin, the loose skin, like you say, just gets in the way sometimes.
Well, because for somebody that does lose a lot of weight, that loose skin really isn't going anywhere, is it?
No, it just stays. The more weight you lose, the more loose the skin gets. So somehow that skin needs to be taken away with a tummy tuck.
Let's move on to our next patient. I got to say, this is a significant difference. That contouring on the sides, on the obliques, is just amazing.
Yeah, this is a bubbly middle-aged woman. She has curves, natural curves, but you really can't see it under all the fluff that she has around it. So basically, after undergoing the Thymus Tuck, she's got her hourglass shape back.
I kind of have to laugh. Reduce the fluff. We all, at some point in our life, feel like that. But it's amazing that difference in the contouring. And then our last patient, looking at that one again, you were able to really contour in and getting almost that hourglass figure that so many women strive for.
Right. Well, this last patient is a single mom. She's had a few kids already, and she's tried CrossFit and exercise and just can't get rid of the midsection. So she wanted her sexy back. So basically,
you helped her get it.
Yeah, that's right. That's right. She got it back.
So I'm hearing a lot when we're talking about this, for the ideal candidate, that you seem to be talking about people that are very active, that have made healthy life choices, but just need a little extra help to get that ultimate body that they want.
Right. Any type of surgical procedures for healthy patients, you have to be a healthy candidate first without any significant medical problems, and you have to be actively trying to lose weight and in the active lifestyle so that you can get some help from surgery to get you where you want to go.
So this Thymus Tuck then could help somebody who's lost a lot of weight, could help
right.
a woman who's had maybe multiple pregnancies.
That's right.
I saw the one that you had with the surgery. It also helps if you have scars from old surgeries too.
That's correct.
Okay, let's talk quickly about recovery time.
Usually, the initial healing is about 2 weeks for the Thymus Tuck. The more you do, obviously, the more time you need to heal. The initial healing is about 2 weeks to get back to normal activities, and it can take anywhere between 6 to 8 weeks to get back to full active workout activities.
Okay, so for more information or to set up a consultation, it's Timeless Plastic Surgery, 281-242-TIME, or check out the website, timelessplasticsurgery.com. Thank you, Dr. Chang.
Oh, thank you.